There are plenty of things psychologists are responsible for in and out of the workplace. The responsibility of patient care is essential. Psychologists must develop specialized programs of care that is fit for patients with similar mental illnesses and symptoms that they can all benefit from. Care packages to ensure that the patient is also taken care of when not in the presence of their psychologists are also given. This also enables psychologists to be able to monitor a patient's progress and level of care, and may also enable a patient to feel like they are also in control of their own treatment, which may also improve their mental and emotional well-being by achieving a sense of fulfillment or satisfaction. Highly specialized advice to any patient's carers or guardians also comes under this responsibility, as it also ensures that the patients are well taken care of in any other environment, whether that be at home, in an institution, or a place of work.
The responsibility for policy and service development to ensure that patients are protected. As patients present different cases and unique insights to their minds, it is vital that all patients and any information they confide is protected through any confidentiality contracts and up-to-date policies that ensure that they feel secure whilst interacting. It also ensures that a psychologist is also able to access information that they may need to help enable them to be able to give a more accurate diagnosis and form of treatment to each patient. The services available to each patient, such as therapy, counseling and/or medicinal treatment, also need to be continuously developed, as each individual case may not entirely benefit from the existing policies, and so to ensure that patients receive maximum care, policies and services provided must always be up to date.
Physical resources required by patients, such as physical restraints, beds, wheelchairs, or even cognitive therapy tools, must be taken care of by the psychologists in charge of those patients. Such resources not only allow patients to always be surrounded by support, but might also aid psychologists in monitoring a patient's progress, emotional and mental well-being, and care. This responsibility also requires that the equipment be used appropriately to keep both patients and psychologists safe, as well as ensuring that the equipment provided carries out its function efficiently. Other forms of physical resources that directly correlate to a patient's mental illnesses may be day-to-day equipment that a patient may need to use, such as shaving equipment and toothbrushes that have been modified so patients are unable to cause harm to themselves or others. Such equipment need to be given out appropriately by psychologists, as when not provided, may cause harm to patients that may be in distress.
Human resources such as staff required to run facilities also are part of a clinical psychologist's responsibility. The ability to organize day-to-day staff coordination, such as rotas, schedules, and appointments, is vital to allow any institution or services to run efficiently. Clinical supervision that oversee the treatment of patients and any administration of medication by nurses, as well as the training of any new staff and overseeing the work of clinical assistants.
The responsibility for the sources of any information is also key, as not all information may be accurate if provided by patients who are not in a stable condition. This would mean that any files relating to patients must be checked for sources to allow more context to be gathered, as well as regularly updating a patient's file in order to record any progress, new developments of symptoms and treatments, or even in order to gather enough data to conduct research on. Information accumulated over time will ensure accuracy when using any patient data in any sample, as well as monitoring what services and treatments provided to certain patients works most effectively with them. Keeping track of information gathered can also allow a clinical psychologist to be able to understand and analyze any key sources that influence a patient's behavior or distress, which in turn will better how treatment is administered.